first of all, midwives, there are a lot of like different types of midwives. So I am a certified nurse midwife, which means that I became a nurse first and then went on to get a master's degree in nursing. There are some people who are certified midwives, so they're not nurses. And then there are licensed professional midwives and other types of midwives. So it all just has to do with like the training and the licensing process. And there's more about all of these sort of different types of midwives in the Motherly Guide to Becoming Mama, if you're curious. Midwives are, I would think of us as sort of the same background or education or whatever as often as nurse practitioners. So most nurse practitioners have a master's degree in nursing. That's what I have as a certified nurse midwife. So midwives take care of people who are having low risk pregnancies and births. And in most states, it varies by state, but in most states, we can do so independently. So it's not like I have a doctor like looking over my shoulder all the time. I may consult with a doctor, or I may take care of a woman with a doctor if she does become high risk. But many, many times, if you have a low risk pregnancy, you can see a midwife, and that's it. It's not like you're seeing them and then also seeing a doctor. So midwives can do anything in terms of the care of low risk women, and that's like pre-pregnancy, so pap smears, prescribing birth control, treating sexually transmitted infections, treating ear infections. Like we can do all that stuff. We're trained in all of that. Primarily, we're focusing on pregnancy, birth, and postpartum. But then we go all the way through, menopause and beyond. Doctors take care of low risk women, but are trained usually in taking care of high risk patients. So doctors on OBs are surgeons. So if you need to have a cesarean section, most likely you're going to be taken care of by a doctor. Now there are midwives that can do, that can help, can first assist in cesarean sections, so you can still have that. The philosophy of care of a midwife, and this is not to say that there aren't many doctors who feel this way too, but the philosophy of care of a midwifery practice is one that is very holistic. So the word midwife means with woman. So we're very much sort of walking beside you on this journey. So midwives are very interested in talking about the whole experience. So we're interested in knowing, like, how are you feeling in your body? And like, how are you feeling in your mind? Like, let's talk about how those things connect. And making sure, that the whole you is cared for in this experience. Again, that's not to say that OBs are not the same way, but that tends to be the philosophy of most midwives.
Yeah, I found for me the difference was it's more a bit directive, I guess, when you're working with a doctor, like you need to do this, this, and this. And I found with my midwife practice, it was more like, here's what generally happens. How do you want to approach this? You're more part of the conversation and the decision making on what's right for you. So that's why I personally love my midwife practice.
Yeah, well, I'm glad to hear it. I'm glad to hear it. And I think also, there are lots of OBs who do work that way. So like, if you have, say, a high-risk pregnancy, or your insurance or whatever means that you can't work with a midwife, and you have an OB who like just isn't a good fit, there's a good chance that there is an OB out there who is a good fit for you, because a lot of them, we share a lot of common ground with OBs. So it may, a lot of times also, it's just like a personality thing. So feeling free to switch practices or talk to somebody else. And the same thing goes with midwives. You may have a midwife that you're like, yeah, we're just not coping, or we're not getting along perfectly. Know that like you are a customer, really. So like you can advocate for yourself, and you can continue to look for, as you did, look for the person who's going to be the best fit for you. So my mom is a midwife, and so I've sort of always been around birth. And I think, looking back, I was always destined to be a midwife. I tell this story in the book about how, like, when, like, normal kids would like sit around having tea parties with their dolls, I would like line up all my dolls and like deliver their babies, be like push, push. And I was like 5. So I think I've always been a midwife. And then, but I didn't know that. So I went to nursing school and I worked in pediatrics for a while. And then I went back to grad school and I took one midwifery class in grad school. And I was like, oh, right. So I don't know. I appreciate the science and the evidence behind it so much. And also I've been doing it for 10 years and I still can't get over like how magical it is, like I still I'm like at a birth and I'm like, but I still don't like how? Like what? It's just incredible still. The more I learn about it, the more I'm like, my gosh, like this is amazing. And I love helping women to feel strong. I feel like we all have a job to do here, and that is mine. It's helping women to feel strong when they didn't fully understand it at first. And I feel like I can do that best as a midwife.